Kardia. I'm the Senior Associate Dean for Administration at the School of Public Health, and I'm sorry that Chuck, who's got a terrible upper respiratory illness, isn't able to meet with us today or be here. He's very sad about that, and anybody that knows Chuck knows how enthusiastic he is about the learning health sciences and actually about the ELSI work that his team is doing and that it was represented here. I mean, I think in many ways today's symposium sort of has been a huge testament to the sort of deep dedication that many of the professionals that are sitting here and the community partners have to really serving and protecting the many, many people that our healthcare system touches. And that in many ways we're very, very lucky to be able to even do this work. There are many countries that don't have the kind of infrastructure that we do and have the capacity to do this kind of work to help make a better system, a better medical system, and in my school, a better public health system. We're at a sort of pivotal time where we see the vision of the learning health system, or for instance, a learning public health system, but being able to walk that respectfully out, I'll call it of the idea into the dream, is a major undertaking. So I want to just pull our attention for just a minute to not only the much work that has to be done, but the much work that has been done. I think if you look at the history of the work from sort of the ethical perspective in the biomedical field into this now learning health system, the interdisciplinary work is astounding. I think Chuck's not here, so I'll give him sort of the podium for a minute. I'll sort of channel him that, he actually envisioned the learning health system as a major transdisciplinary enterprise, enough to convince our health system and our medical school to start the very first Department of Learning Health Sciences. And there's a way, that's right. And it sets the tone for actually the seriousness of the enterprise in which we've all been discussing today. I think another great step forward has been this ELSI conference. I mean, this is the first one at the University of Michigan that's taken place that's pulled all these pieces together, and I can absolutely see this being something of an annual event because it's so transdisciplinary. And then I want to pull to one more piece that wasn't really brought out but is actually sort of tucked into the back of the program, is that we have the opportunity to actually produce journal articles for a special edition that sort of set the stage for the whole continuum or spectrum of issues that have been discussed here. And so this is sort of your invitation to submit proposals. I think Jody will also sort of ask you to do so. And then the last thing I'll say, because it's late on a Friday afternoon, is that in no small part we owe Jody Platt a huge thanks. She took the kernel of an idea and walked that dream into reality, and anybody who's put a symposium together knows that's no small feat. And so I'm just going to end there and say thank you so much for a wonderful day, marvelous talks and discussion. Jody?
All right, thank you. Thank you. And I'm going to say that about 6 more times, but not 7, because it's sort of between me and happy hour, which you're all invited to at Hopcat after this, in all seriousness. No, that's not a joke. There we are, conclusion. It's always a little bit interesting trying to put together slides for a conclusion of it for a day that you don't know exactly what's going to be in it, but it has been quite impressive, and again, thank you for coming. Ray at the very beginning said that this was the start of a conversation, and I want to reiterate that and to say that this is actually what I hope is not the start of a free fall, but rather the start of a conversation that's sustainable and will go on perhaps in sort of on an annual basis, on an ongoing basis. I can tell you that in preparing this conference, I spoke with people who are building learning health systems in the state of Michigan, nationally as part of the CORI efforts to build out their network of electronic health records, and others to try to understand what were their questions and what are the actual sort of specific scenarios they need feedback on. We sort of decided it would be an overload to try to bring those in here today, but they're queued up and ready to go, and starting on Monday or maybe after Thanksgiving, please, we'd like you to sort of weigh in on those questions because they are real. And we started today at a very high-level discussion of learning health systems and sort of made our way down to realize that this is real. It's happening at Vanderbilt. It's happening here. It's happening all across the country. And that we are the community of practice that's going to sort of inform the ethical, legal, and social implications of that work. At least that's my hope. Again, we sort of started with this idea that to stretch, to sort of take advantage of the interdisciplinary work that we already know how to do and keep that going. We do have a special issue of the Journal of Learning Health Systems. Chuck Friedman is the editor of that journal, and we're accepting papers for that, and we hope to have a sort of a rich group of papers that will be a part of that. Come again, stay connected, and again, share your thoughts either via email, Facebook. Apparently our Twitter sphere has been very active today, which I'm excited about. And we do have an evaluation in your program. Take a minute, fill it out so we can get funding for another event like this. So, yes. Thank you very much. See you soon.